This video is intended for educational and informational purposes only. It does not substitute professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before making any changes to your medication, diet, or treatment plan. Self-medication is injurious to health. The creators of this content are not responsible for any outcomes resulting from the use or misuse of the information presented.
Hello everyone. As you know, I am Dr. Adnan Sheikh, and today I have invited one of my super senior, and he's working as a community health pharmacist. He had worked as a medical writer before, and his name is Dr. Pradyuman Singh Rajput. He's my senior, and today he will be discussing about the community health pharmacy. And the stage is completely yours, Dr. Pradyuman Singh Rajput.
Thank you, Adnan. So today I have a topic that is less talked about and less walked about. That is public health through community pharmacy. So as Indians, we have different perspectives on everything. So the same applies to the public health part of the community pharmacy too. So it's an Indian perspective. So let's get started. So the first, I would like to start with the quote that the doctor of future will give no medicine, but will interest in his patients in the care of the human frame, the diet, and in cause and prevention of disease. So today we will be learning about the public health foundations, how the community pharmacy plays a role in public health, how we can connect it to our everyday practices, and we have also some case studies from the history, and then we have some public health practices that we can apply in our pharmacy, and also how we can evaluate its impact and benefits. So this is an ICMR data from 2016 that states that 30 number of deaths occur every hour that is attributed to hypertension. So that's a large magnitude to take care of, and we will keep that in mind. So before starting the topic, I would just like you to know why I chose community pharmacy. So it was a gap in the healthcare system, which I observed, and I saw many patients landing up in hospital just because they missed their basic care or the primary care, which was to be delivered in the primary levels of the healthcare. The factors were poor health literacy, unmonitored conditions, and that all led to admissions in the hospital, and that can be avoided. So that's when I realized that community pharmacy is the first and the most accessible healthcare point in the community. So I started my practice, and I make sure that I don't skip these basics and educate, detect early, and prevent escalation of any disease. So why public health matters? Why we should have its importance? So currently India is facing dual burden of disease. We have a rise in lifestyle diseases, and we are still fighting some infections that are currently in low magnitude but are there. So pharmacists are at crossroad of both. So as India has a growing population, we also have a growing health access gap. So as we all know, India is the second most populous country in the world, and the doctor to population ratio remains inadequate, and that leads to overcrowding in the hospital, long wait times, and limited specialists. Then, so how public health empowers you? So it gives you a stronger role in the community. It gives you a respect and recognition. It gives you a chance to collaborate with doctors, government programs, and NGOs. It also leads you to as an opportunity to lead local health initiatives. And by this, you also get your impact and your business. You build trust, you grow practice. These services increase footfall. It creates a loyal patient base. It positions you as a health partner and not just as a seller. And it also opens new door for new services like wellness, nutraceuticals, and health camps. So why community pharmacy? Why only community pharmacy is the place where we can do all this thing? So pharmacist has a strong health knowledge. He has a strong foundation in delivering this public health services, and we are highly accessible. We are open for extended hours, or even in some condition there are pharmacies are operating at 24/7, and we have no appointment required for visits, and we are available at various facets. like the supermarkets, hospitals, retail outlets. And this broad window of opportunity helps us to provide the preventive and public health services which we want to provide. And these help fill gaps in the healthcare access, especially for the patients who are avoiding or delaying their visit to the doctor. So by this, we can act as a trusted information source. We can provide lifestyle advice, diet, exercise, and behavioral change, and act as a first line resource for early signs of illness and guidance on the OTC part, and even as a referral center, we can work. So as every profession is growing, we are also observing changing roles in the pharmacy. We are no longer retail outlets. We are becoming the first points of care, and we have the community trust and knowledge. We have the daily visibility, and we also have the access to the drug use pattern of the patients. So these positions as for the screening part, the health promotion part, and awareness part every day. So the rise of community care. Even health policies are shifting towards preventive, promotive, and community-based care. If you see, PPR 2015 gives a lot of scope of services to the community pharmacy to deliver to the community. And these all are aimed at easy, accessible, and affordable local access to care. And as discussed, we are non-appointment based care. So we will be starting from the public health part, the foundation, the background of the public health. Science and art of preventing, by definition, public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts of the society. And when taken in the considerations of the pharmaceutical terms, it is the application of pharmaceutical knowledge, skills, and resources to the science and art of preventing disease. So, public health focuses on strengthening the primary care. It, by definition, it is continuous, comprehensive, the first point of contact, and coordinates to the other care. And certain elements of the primary care, that is self-care, first contact care, management of chronic disease, health promotion in primary care, and primary care management. Just to give you an idea, a population-oriented care is highly different from the individual care, because here the perspectives are mostly in the broader terms, like the risk factors that needs to be taken care of, and while individual care could be highly personalized based on patient to patient. So the chronic disease that needs to be considered, like in India, these are coronary heart disease, stroke, hypertension, hypothyroidism, diabetes, mental health problems, chronic obstructive pulmonary disease, COPD, asthma, epilepsy, and cancer. So we have also the key domains of the public health, that is the sanitation and hygiene, that is well looked after by the governing bodies, the municipalities, which makes access to safe water, waste disposal. That's an important part of the public health. And then we have vaccination and immunization, in which we have a role. Even the government bodies have the main role, but we can assist those roles by health awareness and health education. And the third is health education through awareness campaigns, through posters. Then we have disease prevention and surveillance. So at a pharmacy, we can also promote this stuff also. And then we have nutrition and lifestyle interventions based on patient to patient. These are the 5 domains of public health on which the public health is based on. So just to also give an idea about the public health and the medical care, as discussed, it has a population focus rather than individual focus. It prevents illness. It's proactive. It intervenes using education policy through the community. And a well example is a tobacco control campaign. While a medical care is highly individualized, indulge in treating, is reactive after symptoms, and often based on diagnosis and prescription. Example, COPD treatment. So, moving forward to the 4 pillars of public health. These 4 pillars are health promotion, disease prevention, health protection, and health surveillance. So just to give you an idea, these all stuff are being studied by the people who are doing MPH. and they are highly focused on the public health part. But we have a role, and we should know that. So stick to the topics because it would help you in your practice or in your daily life. So, as I said, the four pillars are health promotion, disease prevention, health protection, and health surveillance. So, starting by health promotion. So, health promotion are activities aimed at enabling individuals and communities to increase control over their health. That is through educating on nutrition, hygiene, mental health, supporting behavior change like quitting tobacco, and then we have community engagement through workshops, health fairs, and we can also help like addressing social determinants of health, because various diseases also have a social determinant to it. That is due to poverty, due to lack of education, due to access to high quality healthcare, these all can happen. So, what's the role of pharmacy in health promotion? So, we can display educational materials, posters, can offer counseling on the preventive health and the medicine use. We can host awareness drives such as anti-smoking weeks or BP checkup camps. And we can also partner with the local NGOs or the local health programs through government bodies that can help us promote health in our area. Then we have levels of prevention. So before moving towards the other section, that is disease prevention, we should know the levels of prevention. So just to give you an idea, that is a primary, secondary, and tertiary. Where primary is generally using health education and behavioral change, that is dietary or through dietary means, through smoking cessation, through exercise. And then we have immunization that prevents a lot of disease and infections. Then we have welfare benefits through the government. Then we have the community development. Just to give you an idea, community development is the part of the social determinants of health. That is access to education, access to a proper house, access to the healthcare. And then we have secondary prevention. That is through detection and management of any disease such as ischemic heart disease, or screening of cancers like cervical cancer, breast cancer, and colon cancer in the community. Then the tertiary prevention is the management of chronic disease in its progression. For example, diabetes mellitus. So that was the foundation, and we now see the disease prevention, that are intervention to reduce risk factors and prevent disease before it occurs. So in broader concepts, as we discussed, primary prevention, secondary, tertiary prevention. And also a role of a pharmacist is the promoting adherence to the medication regimens. So what is the role of pharmacy here? We can promote BP checks, blood sugar checks, BMI screening in store. We can refer patients for vaccination or diagnostics. We can educate on self-care and early symptom recognition in case of any escalation in the disease. We can also advise on the chronic disease control in case of diabetes and asthma. So moving towards the third pillar, health protection. So health protection is generally undertaken by the government bodies, that is policies and actions that are aimed at protecting populations from health risk and environmental hazards. So in broader concepts, it is tobacco and alcohol regulation. It is access to safe drinking water and sanitation. Then we have control of hazardous substances and drug safety and rational use. So the role of pharmacy here is to display anti-tobacco warnings, encouraging cessation. Then we have promoting safe storage and disposal of medicines so that the medicine does not lose its quality before the administration. Then we have also a role in monitoring antibiotic misuse, because we should make sure that every antibiotic prescription is a rational prescription. And we should be following the ethical dispensing and counseling practices at our outlets or pharmacies. And moving towards the fourth pillar, that is health surveillance. So health surveillance, by its definition, continuous collection, analysis, and interpretation of health data to guide decisions and action. These are generally through the monitoring disease trends and outbreaks, and reporting ADRs to the PVPI, then assessing effectiveness of health programs, then supporting public health research and planning. And the role of pharmacy here, as I said, ADRs to the PVPI, observing seasonal disease pattern, keeping records of sales spikes, just to make sure of which condition is currently higher side in the community. Then if needed, we can also share that local trends with the authorities. So, as you see, the four pillars, every interaction at the pharmacy window is an opportunity to protect and promote public health. Whether you are counseling on a diet, checking BP, or simply listening to someone, you are already strengthening the pillars of public health. So we would move towards to the public health classic, The Pump That Saved a City. It's a part of the history, and from there, the public health, the story, the public health foundation, everything has begun. And just to give you an idea, this is in 1854 when a cholera outbreak take place in the London's Soho district, and Dr. John Snow investigated upon it, and he found the cholera cases and noticed that they were clustered around one water pump on the Broad Street. You can see here the red dots refer to the cholera cases. And then he mapped out on the special part and he identified that it was around the one pump. And then he convinced the authorities to remove the pump handle and the outbreak sharply declined. So these were the turning point in understanding the disease transmission, and this was the birth of the modern epidemiology. By this story, you should understand that how a certain series of events can be stopped if they are targeted at the origin or at the start of it. So why this story matters? As I said, identifying the root cause, saved lives, and just not treating the symptoms. And this also introduced the idea of data-driven local action for public health. And as a pharmacist, what we can do is that we can be local detector of health risk. We may spot seasonal spikes in fever, flu, diarrhea, asthma. We can observe medication trends and repeat complaints and can reveal an early signs of community level issues. And then we have like OTC cough syrups in the July and early warning for dengue and viral fever trends that can be monitored in the pharmacy itself. So all I want you to be the Jon Snow of your area, and your counter is also a surveillance point. So moving ahead, how a pharmacy is part of the public health. So the routine task that you might be doing is already a part of public health. Like if you are advising patient on BP or sugar, it's a part of health education. If you are suggesting a screening camp, it's a disease prevention. When you are explaining medicine safety, you are doing health protection. And then when you are tracking recurring symptoms, you are doing your role in the surveillance. But it's bigger than you think. Public health not just simply asks what disease, but it asks why here, why now. And for a reference, I may say that the traditional view for obesity, just as an example, obesity is a excess of calories and lack of exercise. While the public health views it as a complex interaction of biology, environment, behavior, and the society. So just to give you an idea how obesity could be linked to other domains, like if you consider in the biological terms, it is like genetics and insulin resistance. In behavioral terms, it is eating habits, screen time, or inactivity. In socio-economic terms, it is junk food affordability or lack of kitchen at home. In environmental terms, it is not access to the parks or unsafe walking paths. In social terms, it may be isolation, it may be stress, it may be the cultural norms around the food. And in case of healthcare access, there it could be due to no preventive screening and low awareness in the community. So why it matters to the pharmacy? So pharmacists are positioned to provide the health education, offer screening services, recommend lifestyle intervention, or refer to the specialist care if required. And we have the time to support behavioral change in the community through counseling. So public health, if public health is the why behind the illness, community pharmacy is where we can act early and effectively. So who gains in this process? What is the advantage of public health through pharmacy? So the pharmacist gains professional recognition. He becomes a go-to resource for local health issues. He builds a bridge with doctors, NGOs, and government programs. He feels more purposeful and mission-driven in the role. The pharmacy builds customer trust and loyalty, increases footfall through added services, and becomes a community health hub. and this gets recognition in government and public health initiatives. While the community, the main stakeholder, gains access to education, awareness locally, receives preventive care, early identification of illness, benefits from less travel and easier access to care, and also develops health seeking behavior within the families. So when a pharmacy invests in public health, the entire community rises in health. So what are your actions and your impact on all the foundations of the public health? So this is a checklist, or you can also view it as actions that lead to the following, like the health promotion. You can do it by educating on lifestyle diseases. You can host BP sugar days where you can monitor the numbers. Then you can organize nutrition awareness or healthy diet days. You can guide on exercise basics, yoga, stress relief. Even a simple deep breathing counseling to a patient could prove him better for stress relief. Then we can encourage immunization. We can promote menstrual hygiene and sexual health awareness. We can provide health booklets, pamphlets in local languages. We can also create a wall board for monthly health theme. Then we can teach hand hygiene, respiratory etiquettes. Respiratory etiquettes can be like taken care of, like in the season of flu. We can teach them to use mask when they are in flu, or healthy sneezing habits using hand, and we can also guide them on reading medicine labels and dosages. Then we have disease prevention. The actions are the routine BP and blood sugar checks, a risk assessment form to identify risk of the individuals, then spotting red flags if there are cases of UTI or wound infection. Then we can also refer the at-risk customer to the nearby clinics. We can provide multivitamin or corrective supplementation for those which we can observe, like from the vitamin D or vitamin B12. Then we can do family history screenings of heart diseases and diabetes. We can do periodic food checks for diabetic patients. We can provide test strips and education on how the glucometer should be used. Then we can monitor the BMI, weight with counseling support. And we have also a new role here. We are in the vaccination, and where we are where I am like associated to the IPA, where we are providing vaccination training to the pharmacist. Moving forward to the health protection part. So we can educate on self and if some patient is coming to your counter or your pharmacy and asking for certain medication, you should ask the patient the intended use, and how he will take everything before dispensing those medicines. And the same implies for the OTC part. We also do the part in the antibiotic stewardship. We also collect and dispose expired meds safely. Then we can support tobacco cessation. That is a very good part that we can do. We can guide them on the nicotine replacement therapy. Then we can manage substance abuse using conversations, and if needed, we can also refer it to the higher authorities. And then promoting injury prevention just using a stick. A stick prevents falls by a lot of margin, so that can be promoted. We can also provide first aid kits, ready-made kits, so that each space is covered for that first aid part. And then we can also inform about the safe storage of meds at home. Then monitoring signs of abuse or domestic violence, we can also monitor it. Then the access to the essential medicine, which is the main and trivial role of the pharmacy. So moving towards the health surveillance part. So as we discussed earlier, noting seasonal disease trends, we can also maintain logbooks for fever, flu symptoms. We can help the patient participate in government health programs such as Anemia Mukt Bharat and TB programs. We can observe ADR and report it. We can partner in vaccine reporting and post-vaccine observation. We can help in outbreak detection. And then we can also conduct informal surveys about the community health habits to identify any risk factor or any factor that is causing a lot of conditions in the community. So just to add to it, the behavioral change part. So everything requires a behavioral change. You can't become, people don't change easily. You can't become a go-to person in one day. So just to understand how we can use this theory in benefit for us. So the theory of planned behavior, it's a way to understand how people make decisions about their behavior, and just not because we tell them to do so. So they happen when three things takes in place: the attitude, the social norms, and the control. Attitude. They believe that change is good. Attitude. They believe the change is good. If people believe that pharmacists giving medicines or vaccines or managing diabetes is helpful, they are more likely to accept it. It is like, if I think pharmacist can help me with my blood pressure, I will visit them. Social norm. If they see support it, like if the family doctor or society believes it's okay for pharmacists to give such services, they will feel comfortable using it. Like for example, my friend said the pharmacist helped him quit smoking. I should go to. Then the control part. They feel it's easy and possible. People act when they feel it's convenient, safe, and within their reach. The pharmacist is nearby and friendly. So I can ask them about vaccines, or even I can ask them about certain conditions. Everything can be done. So the same thing, that how we can imply those action. We can showcase value through stories, outcomes, and benefits. We can leverage public endorsements through community voices, and we can remove barriers and increase visibility and simplify access to the care. You can get an idea for how we can change the behavior of the community and make it on the benefit side of the pharmacist. So what's the application in the pharmacy role expansion? The first is to create a belief, then enable those behavior, and then normalize change through community expectations. So people won't use what they don't believe in. So first you need to build the belief, and then you need to change the behavior. So just to give you an idea, tried and tested ideas from the recent studies. So I have a systematic review that showed a various thing from the 24 studies that smoking cessation program in pharmacy are effective, weight loss support is effective, and even pharmacy-led management of diabetes, cholesterol, and blood pressure is also effective. Then a literature review by Agomo in 2011, they identified a lot of services, and you can see the dominant themes. What community pharmacists were offering was from ranging from smoking cessation, healthy lifestyle advice, emergency hormonal contraception, infection control and prevention, cardiovascular health and BP control, drug misuse, and addiction management. These all themes are being utilized in the community pharmacy. So what ahead? So your immediate action plan as a community pharmacist should be to launch the smoking cessation services. You can counsel the patient for the NRT, that is nicotine replacement therapy. You can address drug and alcohol addiction. You can deliver immunization and vaccination services. Upon training, then you can screen for cardiovascular risk, diabetes, osteoporosis. You can lead fall prevention efforts. You can offer personalized lifestyle and wellness guidance. We can offer counseling on disease condition, medication, and adherence. And for the system capacity building, like we can train pharmacy teams in public health skills. Then we can create private, respectful consultation spaces where you can give your counseling properly. You can also demand a fair reimbursement for your services you are providing. Then you can raise public awareness through outreach and visibility on social media. Then you can collect outcomes, data to prove impact. And you can also fill critical gaps in pandemic response, disaster preparedness, and inequalities. So 30 minutes, I guess we passed 30 minutes here, and more 15 deaths based on ICMR 2016 data have occurred. And that is just due to an hypertension, which was not well controlled. So be cautious, be alert. You need to treat every patient equally. So you are a public health warrior, and that was my time. Thanks, Adnan, for providing this platform to providing this detail on public health to the community pharmacists, and even more pharmacists who will be watching this.
Thank you. Thank you so much for coming here and speaking sharing your knowledge and what can be done by the community pharmacy and what a pharmacy people can bring a change by taking a part of the community pharmacy, and this can be revolutionized thing that can be occur in the future. So I'm wishing you
Exactly.
all the best for your future. And Origin Hyper Pharmacy. If you are someone from Surat, this is a free shout out to Dr. Pradyuman Singh Rajput. Please do visit his pharmacies and take extra benefits from it. Thank you so much.
Thank you. Okay.